Starting today, Medicare is launching a new pilot program that'll help cover GLP-1 drugs prescribed for weight loss. Eligible seniors could pay as little as $50 a month, but there are still questions about how this will work.
That's right. We are joined live by Dr. Juliette Cubanski. She's the Vice President and Director of Medicare Policy at the healthcare research nonprofit KFF. Thank you so much for being with us this morning.
I'm happy to be here.
Yeah, so why has Medicare historically not covered weight loss drugs, and what's changed now?
Well, the law that created Medicare's drug coverage said that Medicare couldn't cover weight loss drugs. That law passed over 20 years ago, back when we really didn't have very effective drugs to help people lose weight. But now we do. We have these new GLP-1s that were originally developed to treat type 2 diabetes, but they're really effective weight loss medications. The law still says Medicare can't cover them, however. So what we're seeing right now today is the government stepping in with this temporary program. It's not changing the law, but it's offering people with Medicare who might be eligible temporary coverage for these medications for weight loss.
Dr. Cubanski, let's talk about seniors. You know, seniors are on fixed incomes. Many don't have a lot of extra money to spend. Of course, they may have been priced out of these medications. So we want to ask you, how big of a difference will this make for seniors?
It is a big deal. You know, as you said, these drugs are expensive, and a lot of people with Medicare, they live on, relatively low incomes. The out-of-pocket cost for these drugs, even with, insurance coverage, but certainly through these direct-to-consumer programs for people who don't have coverage, can be $200 or $300 or even $400 a month. That's a lot of money for most people, but also, people with low incomes living on Social Security benefits, which is a lot of people with Medicare, have really been priced out of being able to access these medications. So it is a big deal that Medicare is now offering coverage of these drugs on a temporary basis.
Right. And let's talk about that temporary basis. So this is a pilot program. It runs through the end of 2027. What happens after this temporary period?
Well, at this point, we don't know what happens. And that is a big concern because in order to maintain the weight loss that people achieve from taking these medications, you need to keep taking the medications. So right now, we're not sure what will happen at the end of 27. It's very likely that the agency that runs the Medicare program will be doing whatever they can behind the scenes to try to establish some other form of coverage that will allow people who start taking these drugs under this new bridge program that will enable them to continue that coverage once the bridge program ends. But right now, we're still not sure what will happen at the end of next year.
As we've mentioned, these drugs are very expensive, and critics talk about the potential cost to Medicare. So how is the government balancing access with affordability?
Well, there is a concern about the underlying cost of these drugs. The government has negotiated a pretty low price for these drugs, and they'll be made available to eligible Medicare beneficiaries at a $50 copayment for each month. That's considerably lower than the out-of-pocket cost that other people without Medicare coverage are paying for these drugs. So that will really help in terms of affordability for people with Medicare. In terms of the federal government spending, really Medicare is on the hook for what Medicare beneficiaries themselves aren't paying in the form of that $50 copay, which is why it's really not a sustainable long-term approach to funding coverage of these medications. So I think there's going to be a lot of work behind the scenes to kind of figure out how can we pay for these medications, because we know they deliver a lot of health benefits to people, but we also know they're expensive. And without insurance coverage, they're really unaffordable for a lot of people. So it's an open question right now as to, how we can sustain coverage of these medications over the long term, both for people with Medicare, but other people as well.
Right. Well, in this temporary period, it seems like it will help a lot of people, but long term, there seems to be more conversation that's needed. Dr. Cubanski, thank you so much for being with us this morning.
Thank you so much.